30 seconds.
Hello, and welcome to this morning's event. And the star of the event this morning is actually not me or the speaker. It's this book by John Ashton, Blinded by Corona, dealing with one of the most appalling public health epidemics in the history of this country, certainly the worst in the world's history for 100 years. And there is no better person probably to chronicle this pandemic and its effect in this country in particular than John Ashton. John has been a very distinguished public health academic and also on the service side, an unusual mixture of both academic and service public health for a very long time. As a distinguished academic at the London School of Hygiene and Tropical Medicine, and then in Liverpool University, and then subsequently as Regional Director of Public Health for the Northwest of England. He's been responsible for many innovations in public health, including the development of the World Health Organization's Healthy Cities Programme, the development across the country of public health observatories, providing really good, useful information about health to the population of the regions of England. He's been an outstanding leader as president of the Faculty of Public Health in this country and is well known internationally, not just nationally, but internationally. But particularly, I think he's well known in the Northwest of England. And no doubt more of that we will hear during the course of his talk. As someone who was, I think, the bellwether of the pandemic in many, many ways in this country, it's absolutely wonderful that John has in this book chronicled the background to the pandemic and the coming of the pandemic and the response to the pandemic. And it really is the first and only book that I have seen of its type to give us a really very readable, comprehensive account based on an expert analysis. And I'd very much like to start off this. We've got an hour to start this off this with John talking about the book, how it came about, and what he is writing about in the book and some of his feelings about what went on. John, can I hand over to you for a period?
Well, thanks, Gabriel, and thanks for those kind remarks, and welcome everybody to the Malvern Festival on this spring-like Saturday morning, so poignant on the anniversary of such dreadful events last year. I'll talk for about 20 minutes, I think, about the book and its context and what I tried to do in putting it together. And then we'll have time for Q&A, and we'll see where that takes us. As Gabriel says, I've been in public health a long time, and one of the aspects of my experience in public health has been the number of serious public health emergencies and incidents I've been involved with over more than 40 years in this work, starting with Hillsborough when I was swept up on that sunny spring afternoon and finished up triaging casualties behind Leppings Lane at Sheffield. And subsequently in my work as Regional Director of Public Health, I had to deal with the aftermath of three IRA incidents, the cocklers in Morecambe Bay, the third largest Legionella outbreak in the world literature anyway, not necessarily history, and the mass shootings in Cumbria, floods and all sorts of things. And I think as a result of that, I've got a kind of hardwired instinct for when things are going wrong and when something important is looming, which is really where we start for this story. I think at the end of January last year, when we'd been hearing about what was going on in China with the appearance of the virus, and then this rapid escalation of events, large numbers of deaths, people being quarantined forcibly in apartment blocks, crematoria being overwhelmed, and so on. And then right at the end of January, we had this arrival into the UK of British people returning from Wuhan. I was called up to do an interview outside the hospital at Arrow Park on the Wirral, where they just received nearly 100 people that are coming back from Wuhan. And I was doing this interview with Sky Television, in which I made reference to the phenomenon that we went through in 1999 going into 2000 with the so-called Millennium Bug, when there was great concern that all the world's computers might crash with the switchover from 1999 to 2000. And those of you who are old enough to remember these events will know that when nothing happened, there was then a lot of criticism about what a waste of money this had been. On the first of February, in public health, we were used to the experience of being on hiding to nothing. As if we do everything, we were criticised, and if we did something and nothing happened, then we were criticised. Because one of the big problems in public health that you have to do is so interestingly, the Crown Bahrain saw that interview on television, and he got his to speak there and not just advise them, but to really be very critical of what was the response. And so I found myself in Bahrain in two occasions that year, in February for several days, and then a few weeks later for another few days, during which time I was able to go around looking at everything, searching out in the
John, I think, John, your signal isn't good enough at the moment. I wonder, John, can you tune back in again, come out and come back in again, and we'll see how we get on. In the meantime, I will just say a few more words about the background to the pandemic. And John deals with this very, very well in his book about the infrastructure in the country for responding to these major events, and the necessity of having a proper public health system in place, and how it has worked in the past and how it has been developed over the years. But the history goes back a very long way. John was a regional director of public health, and the antecedents of that post in Britain go back to the sanitary revolution of the middle of the 19th century, when every local authority had to have a medical officer of health. And their job was to secure the improvements in the health of the population. And they weren't a servant of the local authority. They were employed by the local authority, but they couldn't be sacked by the local authority. It was one of the safeguards, because they were expected to speak out on behalf of the public and to produce an annual report that had to be published on the health of the local population with recommendations for its improvement. And that's the tradition that public health directors and regional directors of public health come from. And John has rejoined us. So I'll just hand back to him. John, I was just explaining about the antecedents of public health directors and what they do and where they come from historically. Can I hand back to you?
Thank you. I hope people can now see me. So I was just talking about what I found in Bahrain in February and March last year, I walked everything: the hospitals, the clinics, the airport, the seaport, the causeway to Saudi, the prison, the housing settlements for migrant workers, and so on. And the laboratory, particularly laboratory for public health, where they were doing the testing for PCR. And, they'd set up a war room on the 3rd of February last year with a task force of about 30 people in a big room with a live feed from around the world, with Johns Hopkins, with their own people on the ground, getting reports in of local situation in neighborhoods and everywhere. This was at the beginning of February last year. I say this because the contrast with what was going on here then became very marked, and I'll return to that later. But back in February, we will all remember that as this thing was heating up, we were shocked by the failure of the Prime Minister to get a grip on the situation. What I've tried to do in the book is really to capture on a day-by-day, week-by-week basis that first 6 months of the pandemic, which has now been going on for 14 months globally. And just to give you a flavour of the chapters in it, I'll just run through that, and then I'll dip into it for some of the main features I think that are worth drawing attention to. There's a chapter on plagues in history. The fact that this is not a new phenomenon, that human beings have lived with plagues throughout human history. And one of the things that we know about that is that they can have far-reaching and long-term consequences, which we still have no idea to be in of 1349, which killed a large proportion of the population, had ramifications which extended decades and beyond. In fact, the pest of 1381 was a consequence that had happened 30 years before. What happened on that occasion was that the change in the position of peasants, of serfs, was that because so many had been killed, their bargaining power in the market with landowners increased and their wages went up. The middle class then, the House of Commons, decided that they could start levying taxes on them for the first time to support the war adventures that they were pursuing in France and Portugal. And they came up with the poll tax and levied a poll tax 3 times in 2 years, which resulted in the well-known events of the summer of 1381, when about 500 senior public figures and landowners had their heads chopped off of London. To illustrate the fact that we've got no idea what the long-term consequences of this are going to be. The story of the 1918-19 pandemic of influenza is also instrumental, and I haven't got the time to go into it in great detail here this morning, but I would just say that some of those things that relate to that, the fact that it brewed up in a small, poor county of Haskell in Texas, where a general practitioner had several patients who became very poorly, and he got interested. He pressed the National Public Health Service in it, but they never responded. And the pandemic brewed and brewed in the army camps of the eastern seaboard of the United States, where the soldiers were being prepared to be mobilized to come to Europe and join in the latter stages of the First World War. Woodrow Wilson, the president of the United States at the time, was so preoccupied with the mobilization of the troops and getting stuck in to defeat the Germans that it was off his radar. And there's a very interesting parallel there with the way in which Boris Johnson was so distracted by Brexit at the end of January, coinciding the passing of the bill in the House of Commons on the 30th of January with the declaration by the Director General of the World Health Organization of a public health emergency of international concern within 24 hours of the Brexit legislation. Distracted by that. The nature of the crowd spread of pandemics was very apparent from what happened in 1918-19. The virus was spread by troop ships going up and down the east coast of the United States between military camps. And there was also a major war bond selling event in Philadelphia later in the year, which was advised against. Over 100,000 people gathered for a festival lasting a day, and within days, people were dying like flies in Philadelphia from all the crowds. And we think about what happened here in March, in that week beginning the 11th of March, with the pop concerts in Cardiff, with the Cheltenham Festival, with the Atletico Madrid match with Liverpool coming up to its anniversary in a couple of days' time. And we realized that the lessons of aerosol spread pandemics were just never learned. So there's a chapter in here on the plagues in history. There's a chapter at Straws in the Wind about the many new viruses that have turned up in recent years, starting with HIV and AIDS, with the avian flu. We've had swine flu, we've had Ebola. There have been many others, and we've been warned that sooner or later there might be a pandemic. Gabriel and I, as regional directors of public health, were involved in many exercises, training for just such an event. But it seems that after the recession, the financial crisis in 2008-9, this aspect of public health went off the agenda. The change of government in 2010 and the disastrous Lansley reforms to the health service led to the dismantling of a public health structure which was effective, which we were proud to be part of, with strong local, regional, and national levels. The centralization of public health into Public Health England, highly over-centralized, still on the go for those who are not familiar with this, is a vanity project of the former chief executive of Public Health England to build a massive complex, centralizing the laboratories for England into Harlow Newtown, which will, if it goes ahead next year, when it's supposed to be completed, would suck in the expertise which we always had in each of the regions. So the disaster waiting to happen is a chapter which talks about the history of public health in the UK, how it's been impacted and degraded in recent years, and how the failure to recognise the importance of public health in the town hall at the local level, the local knowledge of public health directors, the independence of their position to be able to speak out on matters, to engage with the media, to produce an annual report, which was like the auditor's report. It was nobody's report but theirs, didn't have to be signed off by the council, but was an independent holding up of the mirror to the situation locally. All those things had been weakened. The book goes on to chronicle the events in China and the arrival of it in the UK. And then we get into this disastrous period where Boris Johnson, distracted by Brexit, distracted by his romantic affairs of the heart, one might say, 2 weeks holiday with his mistress during February, not attending 5 meetings of COBRA, meant that all of the problems that had been identified in Operation Sigma in 2016, which had identified the lack of resilience for health emergency planning. They weren't confronted and addressed, and we didn't begin to try to deal with them. And we lost a month. We had a wasted month in March, while the Prime Minister was otherwise preoccupied. We then saw, as the thing unfolded, how the government turned to a very narrow coterie of advisors, very academic, very much circumscribed by a small number of institutions, very male, very much at the clinical end of medicine, no practical public health people on SAGE, nobody like Gabriel or myself or current people who are currently at the sharp end of practice. And as things were going on, Health England had told the directors of public health that they were not allowed to engage with the media unless they'd got clearance from the comms department of Public Health England, which is one of the reasons why myself and Gabriel and other commentators who were no longer on the pitch because we were retired were turned to so frequently by the media to throw light on what was going on. We saw some of the really inappropriate responses from advisors, from senior people in the Department of Health who poo-pooed the idea of face coverings and masks, who claimed that testing and tracing wasn't appropriate in the British context, implying that somehow we were superior to countries that were perhaps less developed than us, but who actually were making a better fist of responding to the situation. So the book chronicles all of this in detail, takes us into March, when we had this week that I've already alluded to, when we had all these mass gatherings. The government was tardy in stopping them. We had allowed all those people to go on their half-term skiing holidays in late February to Italy and Austria, where the virus was already accelerating. And without a shadow of doubt, the seeding of the virus in the UK across the country can be dated to that. But there was no attempt made to identify those returning tourists to the UK, never mind screening and triaging them, as was going on in Bahrain by then. And it's only in recent weeks that we've seen any effort to do anything about people coming into the country by air routinely. And we've seen the mishandling of that again very recently with the person coming in with the Brazilian virus, who they hadn't even collected a contact address for coming through Heathrow Airport. Of course, once the virus had really taken off in Italy, then we saw that the modelers who'd been producing these duff models with inadequate data going in, the old American computer saying about garbage in, garbage out, so-called GIGO, applied to the models. Because we weren't testing large numbers of people with local public health teams, the quality of the data going into the models was poor. The modelers underestimated the pandemic was taking off. And so where chief scientists said balance, that we really needed to just go for herd immunity. The Prime Minister talked of taking it on the chin. And of course, that lasted about 3 days over a weekend in March. People were aghast at the unethical approach of allowing the virus to rip, allowing thousands to die unnecessarily, as paralleled by what was going on with the discharge of patients from hospital into care homes, setting off a further pandemic or a parallel epidemic in the care homes, which we weren't told the numbers of for 2 or 3 months. We were misled. And this takes us on to another chapter in the book, which is about politically led science and the numbers game, manipulation of the data, only telling us half the truth. We still don't know what's happened in the nation's prisons. It's been impossible for them to keep that quiet over the last month, when it's become clear that most recently 92 out of 115 prisons in the country have outbreaks. This was something which many of us identified as a potential problem early on. In Bahrain, one of the earliest things that they did, following my advice in February last year, was to release 900 prisoners early from Bahraini prisons to reduce overcrowding. Here, it was identified that they would release 4,000 prisoners prematurely. They said this last summer, and in fact, to my knowledge, the most that have been released is about 300 to date. And we know that many of our Victorian prisons are overcrowded, that the prison officers share the same environments with the prisoners, and we don't have any up-to-date tally of how many prison officers or prisoners have died. So the book identifies all these things. It talks about trust as a big issue, the breakdown of trust, the failure to be open and transparent, which the World Health Organization has always recommended openness and transparency as being the key to public engagement. You really need to mobilize the public in something like this. It has to be a partnership. But throughout this pandemic, it's been a top-down event. It's been dealt with by this narrow group in London. They failed to mobilize the local public health teams. We have over 130 local public health teams around the country who know their communities, who have access to the local media, who can be put up as trusted voices to take people on the difficult journey that we've had to go through. Instead, at the national level, the chief medical officer, Chris Whitty, was kept locked up for the first few weeks because of the government's vendetta against the BBC. He was only allowed out for the first time on the 13th of February onto the Today programme, because nobody was being allowed onto the Today programme. And we've seen a parade of people at the national level in the Department of Health, ministers, all sorts of people. There hasn't been a single authoritative, trusted voice. And when you cast your mind back to how Sir Liam Donaldson carried out the function of Chief Medical Officer, or Sir Donald Atchison before him, they would have been out there dealing with this the way Sir Donald Atchison was, confronting the prejudice and ignorance about HIV and AIDS in the 1980s, and making sure that the government adopted a proper, open, transparent, and plain-speaking approach to that pandemic of HIV and AIDS. The herd immunity thing came and went. The lockdowns came and went. Actions were taken too late, too little, and then sometimes too much, as with stopping everybody moving, the failure to discriminate early on between parts of the country that had high levels of the virus and those that didn't, when it might have been possible to do something more refined rather than just locking everywhere down, and then locking everywhere down and letting it up again, inciting people to eat, drink, be merry and shop in the summer, to give the virus a new lease of life, to keep circulating during the summer months. And the constant changing of tack and so on. The book only runs up till July the 4th. What I've tried to do is make sure that during that period, the major things that happened are all captured in one place. Talking to people since the book came out, many people have said to me, you know, things were moving so fast. It's very difficult to remember now what happened when, and how one thing folded into the next thing, and how then about turns led to about turns, and so on. We've got accustomed to that. We've seen how the government has failed to learn the lessons of that first 6 months and has continued to repeat very similar mistakes since. In writing the book, I hoped it would become a source for those who in due course will wish to hold the government to account through whatever means are possible. It's 3.5 years till the next general election. There are judicial processes being initiated by people like the Good Law Project. And it's really important that we should capture the experience of what's happened. Well over 130,000 people have now died from this virus. We have grieving families all over the country. We have a government that, when it suited it, has drawn comparisons internationally. But when it's not suited it, because we've done so appallingly badly in handling this, then they've said you can't make international comparisons. Clearly, the vaccine program is about the one thing that the government can claim some pride in. But even here we have a problem, we have an issue. We dealt with pandemics in this country from the 1840s onwards, before there was modern science, before there were vaccines. We did it by shoe leather epidemiology, by local intervention, by tracking down where infections were, by quarantining people, and by mobilizing local communities. We need to be able to continue to do that into the future. The vaccine is a God-sent blessing, and we must all welcome it. But it's not the answer to all our prayers. As the Director General of WHO has said recently, very frequently, nobody's safe till everybody's safe. As long as this virus keeps circulating at high levels, it will mutate. And if it mutates, it may mutate in such a way that the vaccines are useless against it. And we may well get mutants here, either homebred or from abroad. And it's interesting, the way President Trump insisted on calling the COVID virus the Chinese virus. There's a long tradition of this. The British used to call syphilis the French pox. The French retaliated by calling it the English disease. And when we talk about the Brazilian virus and the South African virus, we're falling into the same trap. We produced our own variant here in Kent, and it seems as though there are other variants circulating now which have also arisen in this country because of our failure to suppress the virus during the spring and summer of last year. And we will expect more of the same if we carry on down that route. So we have to follow the path of traditional public health, use the vaccines in a proper way, and hold the government to account. And I hope that this book will be a useful tool in that process. I think I should stop here, Gabriel, because I think I've probably gone on too long. But I hope that's been of interest to the listeners and viewers.
Thank you very much, John. You went on beautifully, may I say, despite the technical problems. It is a really good, what you don't say, but comes through in the way you talk about it, is that it's very well written and very readable. And if I heartily commend it. And if you're watching this, you can buy it. I think there should be a button at the bottom of your screen that if you're impelled to buy it, that's how you can do it. And you get a signed copy, what's more, with John has a very distinguished autograph that will appear on it. So thank you very much, John. And if we've some more time, with 25 minutes, so now's the opportunity to send in any questions you want to be answered. And we've had one or two, but I just want to start off, John, by saying that one of the moments I thought that was particularly important in the whole pandemic was your appearance on Question Time on the 12th of March. And I turned back to that and I watched that again, and you deal with it in the book. Could you just tell us a little bit more of the color behind that, about what happened that night? Because it was quite remarkable television. It will be one of the standout video clips of the pandemic. I've no doubt about that. And then what the aftermath was like.
Well, to just cast our minds back, I came off the flight from Bahrain on the 11th, the morning of the 11th, and I'd seen what they'd done in Bahrain, partly as a result of my advice, but partly because the Crown Prince, who's a history graduate from Cambridge University, was so on the ball and was very aware of the need to be proactive at the beginning. You know, they'd stopped crowd events, they'd postponed the Formula One race, they'd ordered more PCR machines in February. They now, if you look at the league table of what proportion of the population has been tested in different countries, I think Bahrain is third or fourth in the world for the number of tests they've done per head of population. And they actually demolished and built new blocks of apartments for the migrant workers to improve the environmental standards. Unbelievable. They built a high quality Butlins holiday camp for people to be quarantined in coming off the planes into the country.
They question time, people. John. Question time. How did you get on? Question.
Well, I had all this in my mind when I got off the plane, and I came on to Question Time, and that was the week that the Cheltenham races were going ahead, the pop concerts were going ahead, the Liverpool match was going ahead, and there was this man, Stephen Barclay, Minister in the Treasury, who was so complacent, and it was just unbelievable. I was so wound up by the contrast between what I'd seen in Bahrain and what was going on here. We were sleepwalking into disaster, that I just wasn't going to be silenced. And of course, Fiona Bruce, patronized me enormously. I later, you should have a look at this. If you do a time count in that program, Stephen Barclay got 21 minutes. I got 14. I do feel sorry for the other panelists because they didn't get much between them. But in fact, it was Stephen Barclay who dominated it in time terms.
Yeah.
The audience were on my side. Fantastic audience from West Bromwich, totally on my side throughout the program. And once the program finished and they stopped filming, they gave me a standing ovation, the audience. It was quite remarkable.
Really? Oh.
Yeah, it was quite remarkable. And yet you wouldn't know that from the way the BBC handled it. And of course, I hadn't been back on Question Time since, whereas Stephen Barclay's been on 2 more times. But, that week, it was the wake-up call. It was like being at Hillsborough again. It was like, the moment at Hillsborough when I knew that something was going badly wrong. That was the moment on the 11th when I got back into the UK. And then on the Saturday, of course, I was interviewed by Matt Fry on Channel 4 News. And Claire Gerarda, former chair of the Royal College of General Practitioners, said she was very pleased that I wasn't on stage because I was completely misguided. That's what went on that week. It was a very eventful week.
Yeah. John, one of the questions that's come in from Karen Cox is about the latest set of reforms, in inverted commas, and particularly the abolition of Public Health England and what may replace it in terms of some new Institute of Health Protection or whatever. And what do you think about that? Will it be a strengthened public health system or more fragmented? What do you think about what we know, what little we know about the reforms to public health?
Well, we saw how badly Public Health England performed last year in terms of the testing and tracing, the failure to credible advice. They failed, but you don't change courses. What needed to happen was that Public Health England needed to be reformed and strengthened. Public health needed to be decentralized, to rebuild the regional level, which you and I worked at for all those years, and helped to knit together the responses from the local level. But the local level has to be the front end of public health. It can't be in Wellington House or one of the Department of Health buildings in London. I mean, it's nonsense. So I think it was a mistake. We don't know what's coming next. At the moment, we're rudderless nationally on public health. We need strong national, regional, and local public health. Yes. And it's absolutely essential. And that you in raising this, you also, I think, touch on the fact that throughout this, there's been this argument, particularly pursued by what you might call born-again free marketeers, about how people who are going to die were going to die anyway because they're mostly old or older, and why are we crippling the economy just to save a few lives? And quite apart from the ethical and moral dimension of this, the fact that public health and the economy are totally interdependent seems to have passed over the head of these people. The countries that have done best on tackling the pandemic have also done best on protecting their economies.
Yeah. A little question from me, John. You mentioned in your talk Chief Medical Officer quite a bit. And I was wondering, one of the things that I pick out of the book is the importance of having a Chief Medical Officer who actually knows about public health and has trained and practiced in public health. And of the 4 Chief Medical Officers in the UK at the beginning of the pandemic, only one had a public health background, and that was the Chief Medical Officer for Wales. How much do you think that contributed to the poor response?
I'm absolutely with you on that. I mean, I think, Chris Whitty seems to be a good man, an able man. He's a clinical epidemiologist. He's not a public health practitioner. He's not done a 5-year postgraduate training in public health. He did a master's in epidemiology at the London School of Hygiene for a year. And I have nothing against him. But what we really need is the equivalent to a national director of public health, not a national doctor for public health. Yes. Certainly the NHS needs a chief medical officer. It's got a medical director. That's fine. You need somebody who's a practicing clinician working in a managerial leadership role in the National Health Service. But when it comes to public health, we've seen how this pandemic has impacted on every aspect of our daily life, on every aspect of government departments, education, transport, tourism, business. You need somebody with their feet under the table in the Cabinet Office who's influential and who understands political life, understands how everything fits together in a holistic whole systems way, and who has the authority to be able to speak out on things. I mean, when you remember what happened after Dominic Cummings went on his escapade to Durham, and the chief medical officer and the chief scientist both accepted being gagged by the Prime Minister. Yeah. Interestingly, Jonathan Van Tam, a week later, came back on that one and, said he thought that the restrictions applied to everybody. So more power to his elbow. But why on earth didn't the chief medical officer say that? Yeah.
Could I ask you, we've had a couple of interesting questions. One from Ruth Tetlow about how the UK's response compares to other European countries. You mentioned Bahrain as an exemplar, but how do you think we did in terms of European performance and reaction? And then the second question from, but a linked international question from Jacob Webb about Southeast Asia and how they learned from the SARS experience when dealing with COVID-19. And what do you think the possibilities are for the UK to learn from the experience of coronavirus to do it better? Do you think that the country is capable of learning? So those two things, international experience and can we learn?
I think international comparisons are really important. I mean, it's interesting how the Germans tooled up very quickly on testing. and we failed. I mean, my understanding is that the Germans had allowed their local level to run down as well in recent years. And German public health is very clinical and very laboratory orientated, in contrast to British public health, which has a strong social orientation around inequalities in health, community development, and all of those aspects, which are so important. But the Germans were pretty hot on getting the testing capacity increased. Partly that seems to be to do with the federal nature of Germany, that they aren't over-centralized into Berlin, that you have the Länder with high levels of autonomy, able to mobilize their health services. So that was good. The Germans are not so socially orientated in their public health as we are. But the Germans have done twice as well as we have, if you will. I mean, I think their death rate's about half what ours is. The weaker ones have been Italy and Spain and France. Greece has done well, which is interesting. I think as you look around Europe, you see that countries that have got strong primary medical care that are not over-dominated by hospitals, well, and the same as Norway fell into trap that distancing and so on has not done. But we've done as we would have expected. That this country has been the leader in training for public health and in practicing for public health for nearly 200, and it's shameful, and it's embarrassing. We are in the same company, as I indicated before, of Brazil and South Africa, places which don't have strong public health systems. When it comes to the Asian countries that have done well, of course, in some cases here, you're talking about really quite authoritarian situations. But at the same time, there's a pragmatism as well gone along with that in terms of how they've applied restrictions on the public. But I think one of the weaknesses we've had here has been down to the personal characteristics of our Prime Minister, who is an extreme libertarian. I mean, he's got no self-discipline, and in his own life, in his own personal life, he's completely chaotic, and he's unable to apply discipline to the country when that's what you need. And the contrast with Winston Churchill is there to be seen. I mean, Churchill did what was necessary in the Second World War to get us through, and we elect governments to do what's necessary. That's not saying we're throwing democracy away. When it came to this, we needed a government that was prepared to be decisive, that was prepared to be open with the public and tell us the truth and to tell us what we needed to do, so that we went with them on this difficult journey. And I'm afraid after that initial lockdown, the trust was broken. And we've seen how difficult it's been in recent weeks and months for people to adhere to what they're being asked to do, because they just don't trust the government anymore.
John, Sue Webber asked an interesting question about the so-called NHS test and trace, and the fact that the government's just decided to give it even more money. Do you think that system can be made workable under current circumstances or not? I'm very struck by, well, you documented very well in the book about how they kind of abandoned testing and tracing at one point. On the 13th of March, the 12th to the 13th of March. And I'm very struck by the way the testing and tracing system that we do have doesn't correspond to international guidance. We don't automatically test close contacts, despite that being the international guidance. We only test close contacts if they get symptoms and things like that. So do you think that system is reformable at all?
I really don't. I mean, you look at depends where you read, 22 billion, over 30 billion being given to private companies, often donors to the Conservative Party, chums, relatives, friends, the local publican. And the tests have been slow coming back, often unreliable. It's unbelievable, really. And where we've got, and you know as well as I do, Gabriel, that the regional network of public health laboratories that existed from the Second World War onwards, that capacity has always been there until recently to be mobilized for these things instead of going out and reinventing the wheel, because the wheel is a private sector wheel where people can take a big cut off the top. If that funding had been put into our local public health departments, restoring the huge cuts they've had over the last 10 years, then I believe that we could have done better. But we've also seeing now, the same over-centralization with the vaccinations. I mean, I'm spending a couple of days a week doing vaccination in Liverpool. The government is determining who should be vaccinated. This really needs to be down to local decision making. If we were being true to leveling up and reducing inequalities, those areas of the country that have the greatest poverty and have suffered the greatest deaths would have more vaccine available to them, and they'd be able to tackle some of the outstanding issues, not least the issue of beginning to vaccinate people who are in frontline positions, the teachers, the police, the checkout workers in the supermarket where there's been a lot of virus spread. These decisions should be local decisions, not national decisions.
Yes. I agree with that, John. In the book, you and in fact in your words, you talked about the mass gatherings and about your decision not to go to the match in Liverpool because of the influx of people. And Martin Worcester has asked an interesting question about. He says, in early March, countries such as Zambia, Ghana, and Uganda were checking temperatures of arrivals and requiring all passengers to fill out tracing forms. And he says this seems to be a result of their pre-existing Ebola protocols they're quick to put in place. And they've done pretty well. And that his question is, is that early border response important? And I was very struck early on in the pandemic. The Pew Institute in the US did an analytical piece and found that the UK and Ireland were two of the few places in the world that hadn't put any public health controls on the borders. And I was looking into this the other day, and I read you'll appreciate this, the 1800 Quarantine Act. There was a separate act for Britain and Ireland. And it is amazing how seriously they took the issue of borders and quarantine. The penalty for evading quarantine, or even for a watchman who left goods or people unattended when they were in quarantine, was death without benefit of clergy, I might add. Now, I'm not suggesting that we should go to those extremes anymore, but it does seem to me quite remarkable that we left our borders open. Do you think borders have public health controls on borders have played a big role?
Well, I think you've actually now opened up another chapter of this, because, it isn't just environmental health and public health that have been run down in this country in recent years. It's also port health. And we saw that in 2014 with the Ebola, when the capacity to screen people returning from Sierra Leone, from the Ebola areas, was so weak at Heathrow Airport and the other airports. Port health has been run down, and we've seen it again now. So, that's another weakness in the public health family of capacity, is the port health services. But also, the last comprehensive public health legislation in this country was 1936. It's 80 years ago, public health legislation. And when John Wynne Owen was alive, he had a project on the go to draft a new Public Health Act for England, which is what we need, because these kind of questions about quarantine need to be properly updated, not something shoved through on the hoof, which is what happened in March last year by order of council, rather than by having a proper debate in the House of Commons, giving powers to the government. We need a proper Public Health Act. If you look at what's happening with the care homes, it's an absolute disgrace. Most people in care homes in this country are in privately run care homes. Some of them big chains run with private equity money and so on. Local authorities have almost no powers over privately run care homes. If they're not up to scratch, you have the CQC, who are pathetic. They really don't have any teeth. And we need to put these services, which are public services, but which have been privatized, we need to put them on a proper footing within a proper legal framework. And one of the things that needs to come out of this from any inquiry is the need for an up-to-date Public Health Act for this country.
Yes, indeed. One of the things I was looking at this morning as I was searching my bookshelves was there was a report. I dug it out, the medical officer's annual report upon school medical inspection and treatment. And we have medical officers of educational health in all local authorities. And I think that's very relevant now. There is so much concern about schools and the virus in schools and the reopening of schools. And the school nursing service has been dramatically reduced, hasn't it, over the years? And I remember as a boy, there were school medical inspections in my school, and my school was built on sanitary principles in the 1930s, and we seem to have lost all of that.
Well, until the demise of the medical officer of health, the medical officers of health had oversight of all matters to do with the health of school pupils. But you've had the double whammy of the local management of schools, that local authorities no longer really manage schools at all, and what happened to the role of the MOH, Medical Officer of Health, and then since the Director of Public Health. So many of the levers that the medical officers of health had before 1974 are no longer there to be pulled. And that's why it's so important to have very competent local directors of public health with the powers to take an interest in and enforce things that are outside of the local authority, not just in the local authority.
Yeah, and talking of those, John, you must be very proud that your son, Matt, is one of those local directors of public health, the Director of Public Health for Liverpool, and has distinguished himself, I think, fantastically as a Director of Public Health, even though he was very recently appointed. You know, he's been fantastic. You must be very pleased with that.
Well, you're very kind to mention it, Gabriel, but yes, of course, we're all very proud of Matthew. He came into it last February, and he had to hit the street running, and I think he's done a great job. But you know, the Liverpool's got a lot of problems again at the moment on the political front, but the council got behind him, and that's the important thing. You need a council and a public health director and team that are singing from the same hymn sheet and developing all those links with the faith communities, with the business community, with the media, and so on. And you know, Matthew's been able to do that, and there are other outstanding public health directors around the country who've been doing their best to do that, not necessarily as supported as my son has been.
Yeah, it's going to be very interesting. John, I wanted to ask you, this book is great, but as you said earlier, I think it's just a great book, a very readable chronicle of such an important time. And you're quite right to say it was such a congested period in terms of everything happening. Oh, quite chaotic, I think. I think you chronicled it extremely well in a very readable form. Have you plans for another volume on the next bit of the pandemic, the one we're going through now?
We see one coming.
John, I think we've lost you.
Health stories to. Hello?
John,
Okay.
I think we lost you there. I'll just maybe I'll just close now.
Now?
John, no, not really. Oh, here you are. Yeah, I think we need to finish now, John. And could I just say, I hope the answer to that question was that there will be another edition of a further volume chronicling the rest of the pandemic. Could I just say, it's to the viewers, it's a really good book. You can buy it by the bottom via the button at the bottom of your screen. I hope you've enjoyed listening to John. He's a great storyteller, and that comes through in the book. And the book has been extremely well and generously reviewed, I think, very, very well. So thank you very much for joining us this morning. Thanks to John for being so open and frank and sharing his views with us. And I hope you have a great weekend. Thank you very much.